Hi everyone, welcome to yet another episode of Health Check with me, Roxana Gichia, only on Coilib TV. So today we are going to have a very interesting conversations. I'm sure most of the time this sickle cell disease is never talked about, but today we are going to have that conversation right here in Coilib TV studios. And joined with me is the amazing Save the Sickler Egerton University Club, headed by the chapter president, who is Lucy Mora, Geoffrey Nyakundi, who is the SCD advocate and a member, and also Benedict Midamba, who is the public relation officer and a sickle cell warrior. So how are you guys doing?
Yeah, fine.
So what inspired you guys to be advocates of the sickle cell disease?
Okay, so sickle cell disease, first of all, it's a genetic disorder that is mostly affecting Africans, because 300,000 of the global births that happen yearly, like 250,000 of those births happen in Africa. But now here is the challenge. In Africa, we don't have like the most of the care that is comprehensive to be given to the sickle cell warriors. So we have like 50 to 90% of the sickle cell warriors losing their lives before the age of 5. And that's really a big problem. So I have had a first-hand experience in the hospital as a medical student, where I had this, a young girl full of dreams, but she's having very long hospital stays that are preventing her from living a normal life. And it encouraged me to start being an advocate for this, to make sure that we are having African-based solutions for sickle cell warriors and giving them the support they need, even in, accessing their drugs, which are also so expensive, and many other challenges that we are going to discuss as we go ahead.
Okay, Damba, you are a sickle cell warrior, right?
Yeah,
so how was it? When were you? When did you know that you have the sickle cell disease, and how has it been so far?
Okay, I was diagnosed with sickle cell disease when I was 5 years old. Okay, I was before. I was having episodes of pain at night. I could have pain, cry the whole night, but my mother couldn't understand why is he crying, always crying. Then one day we went to the hospital, Homa Bay Teaching and Referral Hospital. We heard about a sickle cell clinic that was situated there. So she decided, let me do a sickle cell electrophoresis. Yeah, so that's when she knew I was a sickler. That's when I was diagnosed, and she knew I was a sickler.
Can you say people were supportive, or as Geoffrey has said, a lot of stigma around people with sickle cell disease is a lot and massive. Was that the case for you?
Yeah, there's a lot of stigma, by the way. So, okay, when I was in primary school, I used to have yellow eyes, like my eyes were very yellow. So people used to ask me, why are your eyes yellow? Do you have supernatural powers or what? Then if you tell them you have maybe sickle cell, they say, oh, I don't want to associate with that and that. Because you find many people don't have the clear knowledge about sickle cell. So, when you hear somebody has a disease that you've not heard of, then like you are not comfortable with it, so you'll not just accept it. So that's one of the areas where the stigma will come from.
Oh, okay. Yeah. So I know most of you are asking yourself, what is sickle cell disease? Maybe Lucy, you can elaborate that for us.
Okay, so sickle cell disease, to use non-medical terms, it is a genetic disorder that is inherited. It's just like the way you can inherit tallness from your mother, like the tallness gene, and your mother and your father. Now in this case, you inherit a gene that produces abnormal hemoglobin from the mother and the father, and then if the two meet, they form a sickle cell disease, like SS. Let me just call it SS. If you have that, your hemoglobin will not be the normal one, hemoglobin that is just carrying oxygen in the blood. So this kind of hemoglobin will instead like sickle and form like a crescent shaped red blood cell, which is also sticky, so it goes and blocks small blood vessels and prevents circulation of blood in the body. And this leads to the pain that Benedict has talked about. Now you have pain, there is not enough, you know, nutrient circulation to the rest of the body, and that is why you will find most warriors, they look like, you know, they don't have enough growth like a normal person. Yeah, so that is basically what sickle cell disease is.
At what age can one be diagnosed with sickle cell disease, Jeffrey?
From onwards as low as 6 months.
6 months
Old, yeah.
So do you think our hospitals are equipped enough to diagnose the kids as young as they are?
Yes.
They are?
Yeah.
Oh, okay. Okay. So Midamba,
Yeah.
right now, is there a cure for sickle cell disease?
Cures. Okay, there is gene editing, which is so much expensive, and there is bone marrow transplant. Actually, last year I tried to, I was called by a certain organization so that I could try to do the bone marrow transplant, but then it cost a lot of money. They told me I should have at least 6 million. That one is for the start. Like
6 million Kenya shillings.
Yeah, it's done. It's not done in the country. It's done in India. So there's an organization of doctors from India. They are based in Kisumu. So they were offering a channel so that you can go to India, so that you can be done for that bone marrow transplant. But it's very expensive. So one of the treatment is bone marrow transplant. Then there is gene editing. So the scientists go to the gene that is has a defective that is coding for the production of hemoglobin. So they edit that gene, remove that mutation, then put for you another one. But that one is also expensive and it can come with many complications. So, but now the treatment that we have currently, that I think maybe it's affordable but not that affordable, is the this drug hydroxyurea. Yeah, right now it goes at 50 shillings per tablet, and you should take it daily. Yeah, so there is just that hydroxyurea, then there's that gene editing and bone marrow transplant.
So what happens when someone realizes that their kids or themselves are affected with this disease? So, and the treatment, as you've said, is very expensive. So what do you think the government should do to ensure that it is affordable to everyone? Because this disease can get to anybody, regardless of if you're working, if you're not, if you have a salary or not. How should the government come in to ensure that everybody who is affected by this disease is safe and can handle the treatment?
Okay, that's a good question. Okay, I think the government should incorporate insurance for sickle cell disease in the social health insurance fund that they are rolling out. So that when you fall sick, the government can help you fund that treatment through the insurance. You see, sickle cell disease, sometimes it's not covered in the insurance. You have to cover your meds, your treatment, you have to cover them yourself. I think the government can come in by incorporating sickle cell into the social insurance fund, so that even if you want to go for treatment outside the country, you can, like, the government can help you cater for some needs.
Oh, okay. So I'm going to direct this question to you, Lucy, because you are a woman. As Midamba was saying, that the first time when the mother realized that my baby is not okay is because Midamba was crying so much. You know, sometimes us as women or us as parents, sometimes you just hear your child crying, but you don't really understand what is going on. Sometimes it might be the sickle cell disease, sometimes other reasons, but we do not really bring forward, we do not really think when our babies are crying it is something as complicated as sickle cell disease. So what are some of the symptoms parents should look out so that when their kids are having the same symptoms, they should know immediately this is the sickle cell disease?
Okay, that's a good question. So first of all, sickle cell disease is endemic in specific parts of the country, like in the Lake region, Western, some parts of Kisii and Nyamira, and in the coastal region, Kilifi, Taita Taveta. Yeah, so if you're in that region, so you can start, thinking about that if your child is crying, for instance. But there are also many symptoms. For instance, what Benedict said about yellow eyes. When you have an abnormal red blood cell in the body will destroy it, because to it, it's not a normal red blood cell. So when it destroys it, it produces a component in blood that causes the yellowing of, it's called jaundice, yellowing of eyes and even the skin in general. So yellowing of eyes can be one of the ways. And also, I feel like the parents should be told in these endemic regions, they should be told on how to feel, to check like if the spleen is enlarged. Because these red blood cells that are abnormal, they tend to go to the spleen and accumulate there, and now it causes enlargement of the spleen. So these parents are aware, they can be like touching and feeling if there is, a large spleen. So that's another one. And then a confirmatory test can be done by, going to the hospital and doing what we call a sickling test, where a small blood sample is taken from the child and then subjected to certain conditions to check if it's going to form the crescent shape. Yeah, so that's basically it.
Okay. Geoffrey, you have been an advocate for how long now?
For 2 years now.
For 2 years. So, and you mentioned that we are not having this conversation as often as we should be. So what advocacy work have you done so far?
Thank you so much. First of all, in my social media handles, I've tried educating people about sickle cell disease, their symptoms, complications, treatment, management, as simple as I can. I've tried engaging my friends about the same. I've tried reaching out. Personally, I'm from Nyanza, and it's one of the areas which is prevalent of the disease. I've tried reaching out from some of my medical student friends in those areas to try and do a mass education of the people to help them understand the condition better and remove any misinformation.
How are people receiving it so far?
So far, it's positive.
It's
People
positive.
are accepting it.
Okay. So let's talk about the Save the Sickler Egerton University Club. How did the idea come about?
Okay, so the idea actually came from a general non-governmental organization that is running in the country. It's called Save the Sicklers organization. So Save the Sicklers organization is based in Kisumu, Migori, and Nairobi, and it's expanding its partnerships. And the ways it does this, advocacy and supporting sickle cell warriors is by doing some community outreaches. We have done some in Kisumu, Migori, and many others. And part of the work plan to ensure that we are having more African-based solutions and capacity building among students, we came up with on-campus initiatives, where now the Egerton chapter comes in. We are planning to launch different clubs in different universities and also go back to high school and make sure kids in high school understand sickle cell the way they understand malaria maybe. And the way we are having, for instance, from high school, someone is a St. John's ambulance person and they're so proud of it and they're aware of what it does. That's the same thing we want to do in high schools, to make sure that sickle cell also is so much understood and people are aware, because what Geoffrey has said about the misconceptions, people attributing sickle cell to witchcrafts and women being cast and giving birth to kids that die before the age of 5 years. They are true, and we need to eradicate all these. And the only weapon we have here is awareness, like raising awareness and educating people about this. So yeah.
So what are some of the challenges that you've faced so far?
Challenges that we have faced, of course. Now, okay, let's talk about the expensive management. It's not. This is the issue. when you find like a person living with sickle cell disease, being a genetic disorder, you will find that it's like a family, like in a family, you might get maybe 3 or 4 kids. And then the village, let's have a picture of maybe somewhere in Nyanza, there's a village there, and then we have a family having 4 sickle cell warriors. Hydroxyurea is very expensive, and it goes at maybe at 50 bob per tablet, and it's not the only one that is supposed to be given. There are other management meds, and then like this family lives hand to mouth, so they cannot afford this. They cannot afford this, and now we have to go, you know, raising funds and donating, trying to provide this hydroxyurea. And funds has been a challenge, but we are really going on well, because the more we educate people about this, we are having well wishers coming in. And also we have a problem in data. There is so little data and research like around sickle cell in Kenya. Like it's such a neglected area in healthcare that we are having a challenge, because even when you approach someone and you are telling them about sickle cell challenge in Kenya, they're going to ask you, where is the data showing the truth of this? But we don't have that. And that's among the reasons why we came up with this capacity building on campus initiatives to make sure that we are going to have students doing research and also questioning the existing management ways. Are they okay for Africans? Because, you know, we live in a world where we've been consuming so much from what, you know, has been prepared in the Western world without even questioning what the, you know, like, is it okay for the Africans? You know, sometimes we respond differently. So that's basically how the clubs became to be formed. And later we'll talk about the initiatives that we are working on and the achievements that we've had so far.
So Midamba, how can people come in if they want to help you guys raise awareness, if they want to help you guys inform people about sickle cell disease? How should they reach you guys?
One, you know, nowadays you are living in a digital world. So I think when you raise awareness in the social media platforms, it will reach many people. And also in our hospitals, they incorporate that teaching of the, you know, in remote areas, people have no knowledge about this. So I'm thinking that when somebody goes to the hospital, they can be given a brief awareness or a brief knowledge on this disease.
So yesterday was sickle cell disease day. So what did you guys do yesterday? For you guys who are watching and shooting this episode on Thursday, so the World Sickle Cell Disease Day was on Wednesday, but I know you're not going to watch it on Wednesday or on Thursday. So what did you guys do on that day?
So World Sickle Cell Day is celebrated every year on 19th of June. And for this year, we are so happy because the country, you know, like put in funds and started an event in Kisii. So the celebration was happening in Kisii, and we had a representative. And part of this awareness video was meant to, you know, raise awareness for the World Sickle Cell Day. And also to commemorate it officially, we are planning an event on 6th of July to commemorate it and also launch the programs for Save the Sicklers.
Geoffrey, what are some of the achievements you've made so far as a club?
As a club, we've been able to reach so many people about having the sickle cell disease. We've been able to accommodate them and try to offer help in purchasing, for example, the hydroxyurea, which is a kind of pain reliever to them. We've also helped in purchasing painkillers. We've helped in advocating it in our social media platforms. Actually, we have an Instagram.
You can share with us.
We'll share. Save the Sicklers. So we've educated them through our social media platforms. We've also gone as far as organizing some community outreach programs, which will soon go to areas such as Migori, Taita Taveta, and the likes.
So you guys are launching the Save the Sickler Egerton University chapter on 6th of July.
Yes, that's
6th of July. So what happens after launching it? Now we have it. What happens next?
So part of the ways we are planning to provide solutions to people living with sickle cell disease is by our 3 main programs, and I'll talk about the 4th one. So one is through policy influence and raising awareness. A lot of policies, we are planning to have technical working groups of students working on all the areas that I'm going to talk about. And among the policies that should be involved to make sure that sickle cell patients are well managed is there's something that they need called vaccination. They need vaccinations against diseases like pneumonia, so they need a pneumococcal vaccine, meningococcal vaccine, and many other vaccines because the immune system becomes weak and they have to have something placed to prevent them getting an infection. Yeah, that's one of the policy influence that we want to include there, and also them being included in the social health insurance fund. I was having a chat with the president of Sickle Cell Federation of Kenya, and we are really fighting to make sure that this one is going in the social health insurance fund. Sickle cell patients are going to be included in it, and many other policies, and also raising awareness in the in the endemic areas like Nyanza and the coastal region of Kenya. Also, we have research and innovation, which is now the main point of on-campus initiatives. We plan to have, after the launch, we are going to have technical working groups of students working on different research projects, questioning this hydroxyurea, for instance. There could be so many side effects, yet this is a drug that sickle cell patients have to take for the rest of their lives. And also we are exploring possibilities of checking if we can have new better drugs in the future that fit Africans, because this is really our big problem. And then for innovation, I'm glad to say that we have an innovation team, and it has come up with a very the first of its kind device that can be put on by these sickle cell warriors when they are having the pain that we have talked about. They can put it on, and then it uses heat and massage therapy to relieve their pain. And that's one of the achievements that I'm going to explain how far we've gone with it. And then the 3rd program is dieting and agriculture. We plan to have sustainable agricultural systems that will have plants rich in what sickle cell patients need, rich in iron, folic acid, antioxidants, anti-inflammatory products, to make sure that it reduces their number of crises that they have in a year. And also we will explore further on how we are going to implement that and make sure it's working. And the last one now, which is general, is capacity building, to make sure that you are having many students who are aware of this and working to provide innovative solutions that are sustainable in Africa. Because the treatment options that you are having, like gene editing, that is something that cannot be done in Kenya, not even in the near future, because we are having, you need so sophisticated ways of monitoring the side effects, and some of the side effects lead to it includes infertility and cancer. Like someone after going through that gene editing, they're likely to develop blood cancer afterwards. So you see, that's why we need students, so many of them, to get into being creative and providing sustainable solutions for Africa.
Have you partnered with any other organizations, or which organization do you want to partner with for you to make this whole idea and initiative a success?
So before we launched the Save the Sick class on campus initiatives on 6th, we've already partnered with a few organizations in the country during our outreaches and programs. So recently we were talking to the president of Sickle Cell Federation of Kenya, which is now like an umbrella for sickle cell organizations in Kenya, and they have the same goals as us, and we are planning to work together to make sure like there's a good methodology and logistics to enhance all these student initiatives in the future. So that's one of our partners. And also we have partnered with Nairobi County government and the National Non-Communicable Diseases Alliance of Kenya, NCDAK, because it's one of the things they're working on. And going forward, there are still pending partnerships that we are discussing with other people like Afya Dhabiti project, which is really doing a great job in the country. Yeah. And many others.
Okay. Have you ever thought of, and I'll give this question to Midamba, have you ever thought of maybe supporting those people who are suffering from the sickle cell disease? Like, I know the treatment is so expensive, but other than creating awareness, what about the people who already have the disease?
Yeah, the people who have the disease face several challenges. It's not only about the management of the sickle cell disease. They face psychological challenges, emotional challenges, physical challenges. You know, when you're faced with stigma, sometimes you feel left out and your emotions are disturbed. And also, these people need psychological support, because sometimes when you look at the statistics, you may find that the life expectancy is maybe, let me say, okay, when I was growing up, I was told that we don't pass 18 years of age. And that disturbed. Just imagine living with that. You know that when you reach 18,
you're done.
Like you might die. Yeah. So that can affect somebody psychologically.
Yeah.
So I think there should be psychological supports, like maybe therapies that are offered to these people, because they face a lot of challenges while living with sickle cell disease. Yeah, and also spiritual challenges that sometimes you just sit and ask God, why me?
Yeah.
Then there should be someone offering that support, telling you that just kick on, and stuff.
Okay.
Yeah.
So, Geoffrey, do we have the someone who is talking to these people? Do you have a therapy session in this organization, this club already?
Save the Sicklers, we have someone, yes, who can talk to them, give them moral support, emotional support, psychological and spiritual support. We have one.
Oh, okay. That's so interesting. So what can you tell people who want to join the movement? Okay, will I call it a movement? Is it a movement?
It's a movement.
It's a movement.
Guys.
It is a movement. So what can you tell someone who really wants to join you guys in raising awareness, but they don't know where to start, they don't know what to do, they don't know what should I talk about, how should I start? What can you tell that person?
Save the Sicklers organization and all the clubs are open to everyone who is willing. Like, as long as you have that heart and you are ready to help us, no matter the level of information you have, you are really enough. Your presence alone is enough, because we really have, you know, a lot to do. Even just like being present for a kid that is crying and telling them that all is going to be okay is enough. And even, you know, supporting a child with 40 bob just for one hydroxyurea, it's still a long way to go. And even posting on your social media about sickle cell and making an extra person know about it is still a lot. What I mean is, there's enough space for everyone. No matter your background, information, and, you know, career, there's a place for you in Save the Sicklers, and you can have a big role to play. It will go a long way.
Okay. You know, what I've realized is the Save the Sicklers Egerton University, according to the panel that we have here today, they are all medical students. Is everyone a medical student in that?
Okay, we have some people who are not medical students, and the reason we are having many medical students is because this club, as you have heard, it has not been launched yet. It's an initiative that came up last month, and so we were in the process of registering, but you understand, most of the Egerton University students are not on session. So currently we are having many medical students, but we have a few engineering students, IT, computer related, and we are planning to even reopen the call for more engineering and other courses, because, you know, when it comes, for instance, to innovation, I can offer my medical background and say, maybe this is what is causing this challenge that you're having in sickle cell, and then the engineer can bring the idea into life. So we are looking forward to having them back, and then we can now partner and in our project.
Okay, I'll just have to trick you back kidogo, where we say that genes can cause the sickle cell. Is there any other thing that can cause sickle cell disease?
Okay, what I'm gonna say, sickle cell disease is purely genetic.
Okay.
Yeah, that's right. And it follows the malaria belt. Mostly you will find it like in the areas that are endemic for malaria too. There has been a lot of research around this, trying to find the correlation between malaria and sickle cell disease. And there is no like specific, you know, thing saying that this is the cause, but it's assumed to be that sickle cell disease is like a mutation that happens as our body's way to, you know, cut off malaria or something like that. In the process of the body trying to curb malaria, it gets that mutation. And that's why you will find people with sickle cell trait, they will have, you know, they will not be affected so much by malaria. Why? Because the sickle cell does not have enough oxygen to accommodate malaria parasites. Yeah, so there's that correlation, but it's not scientifically proven like a specific point.
Okay.
Yeah.
So, Geoffrey, where do you want Kenya to be in the next 5 years when sickle cell disease is mentioned? When we talk about sickle cell disease, where do you want Kenya to be?
I'd like Kenya to be in a point where we have done our research and come up with various medical equipment that can support the sickle cell disease. I also want Kenya in the next few years to have as much as Midamba had said here about the insurance and donation funds to help them purchase the medical equipment. Because for some, they might have or rather develop complication, and one of them being acute chest syndrome, whereby the sickle cells occlude or rather block the vessels supplying the lungs, and they may present with pneumonia-like symptoms. And there's a drug to help curb the acute chest syndrome, and it goes for 500 shilling, and it needs to be taken daily. So the donation fund need to be set up to help purchase in some of the medical equipment. I'd also like Kenya to be in a position where we don't view these as a curse or evil spirit or something. We just take it as a disease and not a death sentence. A person can live to more than 25 years, 30 years, because what is out here, it's saying that children can't live up to 5 years, some can't live up to 18 years. We have people in 27, 30 years living with the disease as long as we manage it effectively.
Okay. Yeah. So far, do we have a pay bill? Because I'm sure our videographer here just want to send something in that pay bill.
Oh, yeah, we do have a pay bill, Mchanga, and we are going to share it.
We are going to share it.
Yeah.
So you guys, if you want to support those people who are suffering from the sickle cell disease, we have a pay bill. We'll just pin it down below. So please save that child. If you want to raise awareness again, please make sure that we support this movement. We talk about it every single time. The same way we're talking about the finance bill right now is the same way we're going to be talking about sickle cell disease, because everyone deserves love. Everyone deserves to live. Everyone deserves medical care, because that is what is important. So I'll let you guys to say your final parts and then we end. Let's start with Geoffrey.
My final remarks, I want to say thank you so much for having us here.
You're welcome.
And for the public, kindly, sickle cell disease, as I've said, it's not a death sentence. It can be managed effectively. Let's embrace those having it. Let's support them where we can, financially, emotionally, spiritually. Together, we can eradicate this disease in a few years' time. Thank you.
My parting shot is gonna be, you know, I'm looking forward to a time when sickle cell is a thing of the past. And I really have a strong feeling that we are going to do this through the innovative minds that we have in the country. As I have said, we have a team that came up with, you know, the first of its kind device, and it's still here in Kenya, and it's a medical student, and we are going to have many more like that to make sure that in the future we can have the lifespan of people living with sickle cell disease going past 90. Because I've actually met someone with 52 years old. Yeah, and it's a big movement, and it's a big stride. So I'm really glad that you've had us here, and I hope that you are going to have more conversations around sickle cell disease, and even, you know, put more support into this. Yeah, to make it better.
Okay, Midamba.
Okay, my parting shot to the viewers and to the sicklers out there Remember, sickle cell is not a death sentence. All you have to do is to manage yourself well, because some of these crisis triggers are caused by our lifestyle. So if you manage yourself well, you hydrate, and you go to continuous health check, you can be whatever you want to be. You can be a doctor, you can be an engineer. Let not sickle cell trouble you and limit you, because it is not a death sentence. Just manage yourself well, and that's my parting shot unto you.
Yeah, so thank you so much for everybody who was tuned in today. I think my guests have already said it all. So make sure you play your part, because we are our brother's keeper. We need to take care of each other, because nobody else is coming to save us. Anyway, guys, thank you so much. This has been the Health Check with me, Roxana Gichia, only on Coilib TV. See you next week.